And now we will turn to a more political focus, the political arena, with our next two speakers. It will be the Vice President of the European Parliament, Martin Hojsík, who will be attending online, and a member of the Danish Parliament, who you met a little bit earlier, Kai Liltorp. And together they will share their perspective on as to what should be happening on the EU level and in Denmark to reduce the EDCs in our environment. And I'd like to quickly highlight the role of Mr. Hojsík, who is a long-standing supporter of the European and international endocrine community inside the European Parliament, and one of the most vocal political advocates for a toxic-free environment in Europe. So welcome to the stage. I think you will do after Martin, or how? Yes, so we'll start with Martin, and then you will join us afterwards. Yes, thank you.
Thank you, and good morning from Brussels. I'm really sorry I cannot be there with you in person, but indeed the schedules are crazy busy. But my team and me are trying to follow as much of the conference as possible. And thank you for the really kind introduction. Now, I'm delighted to be here, even virtually, because really this conference shows that the endocrine disruptors are a really big challenge that we need to tackle. And I think for us politicians, your scientific advice is particularly important. And actually, it would be great if we listened more, because that's not happening. That's not new. The politicians are, to a large extent, not listening to the scientific advice for tens of years. And we need to fix the climate crisis when it's really turning into a catastrophe, or wait until everybody is polluted with endocrine disrupting chemicals before we start acting properly. Now, nevertheless, it's really important that we listen more and that we listen to your facts. And I have to say that, I've been dealing with toxic chemicals for, Jesus, last 25 years, coming personally from the civil society. And I'm really appreciating the work of the European Society for Endocrinology and the Endocrine Society, because yes, you did the big part of the work on bringing this topic to the European political agenda. And you did actually the research to find out that Houston, we have a problem. Now, I think that we have really, by now, the sufficient scientific evidence to regulate properly and honestly get rid of endocrine disrupting chemicals, but the legislation doesn't keep up. I know that how we fought back in the day when the first reach was happening about the Article 56 and the mandatory authorization, and didn't manage to get the endocrine disrupting chemicals there. Though, 25 years ago, European Parliament underlined in its resolution the right to know what chemicals are in the product and in what hazardous categories, and then including the EDCs. The EDCs were indeed, as I said, mentioned in the first reach, but not sufficient action was happening, and it took until 2023. So more than 15 years after the first reach was adopted, when we saw the Commission adopting finally the new hazard classes for endocrine disruptors, to pave the way for their identification and classification. Now, the CLP legislation was mentioned is also a huge progress. And I was very happy that I had the possibility to work on it on the previous legislative term. And I'm really proud of what we managed to achieve. Though, of course, one can be always better. I don't like the term more ambitious because, it's actually reflecting the right thing we should do. It's not really ambition. It's something which should be obvious. But, hazardous criteria don't solve the problem on its own. What we need is really REACH 2.0. REACH 2.0 that is better in terms of the information requirements, changes to consumer legislation, but also really better in restrictions as well as substitution of all the endocrine disruptors whenever possible, and really motivating the innovation. And I was happy to hear about the need of innovation in the chemical industry, because I talked to the industry a lot. And the biggest thing they have is the energy prices, which And I know this is not related to endocrine disruptors as such, but the challenging thing is, it's lots of things are blamed on the Green Deal when, actually it was the dependence on the fossil fuels that is the reason for the high energy prices in Europe. And I think this is something which we have to keep on repeating to make sure that the blame is not thrown, as it often is, in the wrong way. And the second thing I find really important relates very much to the EDCs, is that indeed we and the chemical industry in Europe is facing the challenge that the car industry in Europe was trying to, prevent from happening 15 years ago, when the Chinese have decided to invest full on into the electric. And the Chinese are now really the front runner in the green chemistry as well. And the crucial thing is, for our chemical industry, if they will embrace the future of sustainable and circular chemistry, or try to stick in the old paths. And I think the EDCs are really important part of this. Now, what do we need to do at the European level, specifically on the EDCs? The exposure, well, my speaking note said that they exceeded a safe level. Well, but you would tell me there is nothing like a safe level on the endocrine disruptors because they really play at tiny levels if they have the chance. But I think with the safe level, it's about really having a significant impact on humanity. One of the issues is the conception issues. The actual natality rate is something that is a worrying trend in Europe, and clearly the EDCs play a role. So, you might be surprised, but for me, it's actually not surprising, that the majority of the members of European Parliament, and I guess most of the national parliaments, probably with the exception of the Danish one, because it's one of the Denmark is one of the most active on the chemical issues. Never heard of Dr. Shana Swan call what she calls the one-person effect. And really, having children, it's not only anymore about the priority of having children, the socio-economical situation, personal decision. It's down to very physical ability of people having to have children. And I think this is something which is a really serious issue. And I hope that we can get it more across to the politicians so we realize what kind of a grave danger are we facing with the endocrine disruptors. And this is just one of the issues. So I really expect the European Commission to adopt ambitious revision of the REACH legislation, including things like mixture assessment factor, because yes, the chemicals like to play with each other, but also the generic risk approach. And I'm happy that I heard from Polspec that it's something which is going to be used when looked at the PFAS, but this needs to be better enshrined in the new REACH. I expect the faster phase out of dangerous chemicals. That we, simplification should not mean that we actually keep the using hazardous chemicals, but that we are, spearheading the replacement with safer ones without, holding the process back with bureaucratic assessments of risks or years of discussions about safe limits. Well, we should finally learn the late lessons from early warning, as the famous report goes, and not repeat past mistakes. Now, we still have persistent regulatory gaps, such as missing information requirements and very lengthy registration process. And this is preventing the identification and control of many EDCs, and the societal costs are simply too high. Now, we know enough to act, but I think it's still worth looking more into the issue and properly understand and better understand. We'll never be able to get 100% pictures. You know it very well. What are the EDC's impacts throughout the populations, different parts of populations? We need to expand human environment throughout the EU. because there is indeed a considerable knowledge gap between the Western and Eastern countries, creating disparity in protection. And to give you one example, I'm from Slovakia. I grew up behind the Iron Curtain. And if you look today at the map of the PFAS pollution hotspots in Europe, now, with the exception of what used to be the East Germany, it looks like there was no problem in the former Soviet bloc. Why? Well, because if you don't test, if you don't analyze, if you don't look for it, then it doesn't exist on the map. The reality is most probably, or certainly, simply different. But yes, this is why we need also better monitoring, harmonized monitoring across the EU, something that I am pushing within the soil legislation. Now, I really hope that the European Commission will finally listen to all of you, doctors, health practitioners, and scientists, that we will see the legislative changes. It's important to talk to industry, but yes, it's equally important to talk to the scientists. And what gives me hope is the recently adopted review of the toys regulation that shows that progress can be made even in highly politicized political environment. And I think we really need to continue the implementation of the chemical strategy for sustainability and follow up suit by reviewing food contact materials, cosmetic regulations, really banning PFAS in pesticides and consumer products, but do more than that, encourage substitution across the sectors, really push the innovation out. For those who do not want to limit the exposure to the EDCs to protect their children and their offspring, I always say, well, do it for the economy. Because honestly, the cost that we will face from dealing with the chemical pollution, dealing with its impact on fertility issues, diseases, decreasing the IQ in kids, obesity, damage and trust in the products in our market, well, that's a massive cost. And I haven't even started on the cleanup cost that will be needed if we, for example, have a widespread pollution of our water systems and water sources with PFAS. So, yeah, if you don't care about health, please do it for the money, because act we must. Thank you.
Thank you.